Hi, friends. Let's continue our conversation on the topic of the small intestine. I decided to redo the lecture on the topic of absorption, part 3. Again, because people wrote to me and said there are few unclear places when I don't make it very clear for you. So it's redone. Let's talk about when person has a problem in the small intestine, such as IBS, IBD, celiac disease, postbacterial and post-viral infection, means that the person has an inflammation, which clinically expressed in form of gas, bloating, and all of the symptoms. The person can have one or several of those symptoms. That means that the person has an inflammation in the small intestine. By the way, this video is continuation of the part 1, and which is continuation of part 2. When person is not digesting the food that they put into small intestine because there is an inflammation, that means that person cannot absorb. If person does not absorb those nutrients, then person develops deficiencies. The most common, not all, but most common deficiencies when the person has a problem in the small intestine are iron, iodine, B12, vitamin D, and calcium. When person is not absorbing those nutrients, he or she will have complaints with first 3, iron, iodine, and vitamin B12 deficiency. Person will complain about tiredness. Person will never come into the office and say, hey, listen, I have anemia or I have megaloblastic anemia. Tired is the most common complaint in the primary setting. What you do the laboratory work. They are easy to identify on the laboratory work. Vitamin D is a little bit more difficult because person will complain about often bacterial or viral infection. That means that immune system is weak. Calcium deficiency even more difficult to diagnose because person never will come and complain or have a weak bones until person breaks leg or arm and the x-ray is done, and on the x-ray it's seen as the bone structure compromised. Now, in the previous lecture I said the purpose of the small intestine is to break down the food that you just ate into smallest particles that could be absorbed through the surface of the villi, and eventually when they get absorbed, they end up in your bloodstream. Here is an example of on the left is a healthy small intestine. So villi are tall and crypts are deep. Those cells that live on the surface of the villi responsible for absorption. Here on the right, we see the picture of the small intestine with celiac disease. You can see the crypts are not deep and villi are slashed. And you need to understand that small intestine about 20 feet long. But because of this villi, the absorptive surface increased drastically. In every square inch of the small intestine, we have between 5,000 to 60,000 villi. That means that the digestive or absorptive surface is enormous. And all of that for one purpose, to feed your body, to absorb the nutrients that you put into your mouth, get broken down and absorbed in the small intestine through the surface of those villi into your bloodstream. Now let's go to the blackboard and I will show you if there is an inflammation in the small intestine, why you do not absorb. And I will tell you that on example of the on the vitamin D. So let's go. As always, I already pre-draw my favorite picture of the digestive tract. This is the mouth with the teeth. Food will go right here. A mouse has a teeth that will break down the food and weak digestive enzymes in saliva. So digestion starts right in your mouth. Then it will drop through the esophagus to the stomach, and stomach will produce hydrochloric acid, will help to break protein in the small intestine. Let's draw a separate picture. This is the picture of your small intestine with villi right here. They looks nice and healthy villi. So the food get further broken down into the smallest particles and then get absorbed. Let's actually draw the food. Let's say this is the piece of fat. It looks nice and long piece of fat goes in. It's broken down here into individual pieces of fat that could be, only those small pieces could be absorbed through the small intestine and they will get into the bloodstream. Let's draw bloodstream as a red. Here is your bloodstream. And here in the bloodstream, you have here individual pieces of fat. Here they are. And our body will build itself. Let's say this fat get absorbed through the get and build the cell. Here is our cell. It has a nucleus, and the cell membrane is built out of this fat that you just put into your mouth. Here it is. So suppose person complains in the office setting about the weak immune system, and the physician sends the person to do a draw of blood and order vitamin D level. Results come with the laboratory work, and let's say vitamin D level is 28, which is low. So the next step is recommend patients to take vitamin D per mouth in form of supplement 5,000 IUs every single day, and person does it. Next laboratory work is usually scheduled 6 months down the road. Patient again does the laboratory work 6 months later, and the level of the vitamin D in the bloodstream increase, let's say, to 35. This is the not increase that I expect on the laboratory work. If person is taking 5,000 IUs here into the mouth, I expect on the next laboratory work 6 months later about 55 or 60 non-equivalent per deciliter. 35 is not increase that I expect. So this is, this is nothing. So the next question I ask person, are you really taking vitamin D? And person said, yes, I do. I take every single day 5,000 IUs. So my question is, if person put in here vitamin D into the mouth, and it's not here in the bloodstream, where is that? Between what person puts here into the mouth and the bloodstream, there is only one item, and it is the digestive tract. It is small intestine that does the job. It does absorption. If person is not absorbing that through the small intestine, that means to me that person has an inflammation. When there is an inflammation, villi cannot do the job because they are inflamed. That means a lot of that vitamin D that person took through the mouth end up in the large intestine and out of the digestive tract into the bathroom. So let's go to the PowerPoint presentation and let's talk what person needs to do to make sure that the vitamin D that he or she is taking end up in the bloodstream. Let's go to the PowerPoints. Oops. And the first thing that you do, you're thinking, why is that? What is it I'm doing or not doing that food is not broken down and not absorbed? You look for the possible causes, and the most common causes are foods that create an inflammation. Here are some of your choices. Of your offenders. Dairy products, number 1. Number 2 is wheat. Number 3, eggs, then nuts. If person has a celiac disease, obviously you eliminate gluten. So as you do this elimination diet, you try to for digestive tract to make it easy to break down the food. You cook all the food. Here you see the stew that's been cooked, and all nutrients kind of leach into the broth because the temperature breaks down the food. So all those nutrients are right here in the broth. So that makes the digestion and absorption of the nutrients much easier for the digestive tract. People often will say, well, when you cook the food, vitamins, a lot of vitamins are lost. You're absolutely right. For that, you take a supplement of liquid vitamins because you want to replenish them. Liquid vitamins are easy to absorb. And then also during the time when you're trying to identify the cause of your maldigestion and malabsorption, you take supplements of enzymes that will help you to digest the food. I hope, guys, that this lecture is more clear. And if you feel that I didn't present the topic quite well, please write to me and I will do it again. If you have any questions, ask me there. If you need to contact me, all the information on my website. Thank you very much. Bye-bye for now. Like, subscribe.